Good afternoon, everyone, and thank you for joining me and our team for our Medicare Web Services demonstration this afternoon. The presentation that I'll go through is take you through a demo of ZMED, and I am covering what's most relevant to a GP clinic. I did a session yesterday with specialists, and today I'm running it with for GP clinics. Now, I would appreciate it if you if you can put your microphone on mute if you haven't done so. And also, if you have any questions, send them through the chat. You should see a window, a panel on the right-hand side of your screen. There's a, you can expand that, send through your questions via chat. I might be able to answer it during the session. But if you've got anything that you want to stick around and chat to us at the end, if you've got time, I might be able to cover some of your questions during my sessions. Otherwise, we will add them to our frequently asked questions online page, and we will provide you with a QR code towards the end of our session for you to be able to access that. Our session today, I'm basically just going to go straight and demo the Medicare Web Services version, which is going to be in version 35. Just got my screen up. We'll just make sure everyone can see that, which is good. Okay, we'll get started. So in ZMED, in the next few weeks or so, you will receive updated communications with links to our online resources page with information on how you go about updating your ZMED, upgrading your ZMED, and also the new steps that comes with it, which are, there are two main things that I want to start with, that as a clinic you will need to do straight after the upgrade. And I'll go through them first before I get into the billing side of things. Once you upgrade your ZMED to version 35, one of the things that you'll need to do first is do a practice setup. So management, practice setup, and practice, we've added a new tab on the left-hand side. So this tab will allow the practice to submit claims to Medicare, DVA, and also for Eclipse, and they're not looking at AIR as well. This will be the first step that you'll do straight after the upgrade for claiming to work, for Medicare claims to work. This claiming configuration will require ZMED to provide you with a unique ID, and in the coming weeks, look out for communications around how we're going to provide this to our clients. So in this section, you see claiming configuration, and we'll provide you with an ID to enter it into the screen. If you do have multiple branches, I just want to point out that the claiming ID applies to a practice level. So there is a drop down the bottom here. You should be able to choose all branches. So that's for all, and I've added mine up the top there. The next setup is, so that's a practice level setup. The next one you will need to do is to register your doctors for claiming. This is only in ZMED. You don't need to do anything or change anything with Medicare right now. This is just registering, just a new button you need to activate in ZMED once the upgrade's finished with version 35. So I'll bring up one of the doctors so we can have a look at. So this goes to all doctors that's got a provider number and you're currently submitting claims to Medicare. So if we look at, have a look at this particular doctor. Now currently they're set up, you've got a HIC online ticked. Because we're moving to the Medicare Web Services, we will no longer need this to be ticked. I mean, this HIC no longer works. So the replacement of this, if you can leave it ticked, it's fine because it's not going to do anything. But after your upgrade, you will then see this new button just below the provider number. it'll say claiming not registered, and you'll need to go through each doctor and register for claiming. If you don't do this and you submit a claim under that particular doctor, it'll come up with a message and it'll reject it. So this is after you enter your client ID for configurations of claiming, you will need to do this step first before you start submitting claims. I'll show you what it looks like for a doctor that's been registered. So if I bring up this doctor, you'll see here, once you've registered a doctor, it says claiming active. It'll come up with a active tick box, and it'll give you an option to delete registration, and that you don't touch this unless the doctor is leaving the practice. So that's the practice setup and doctor setup. Now I'm going to have a look at patient verification. We'll move into billing after that, and then we'll talk about the where you actually see the claims you submit to Medicare. The first thing I want to show you is patient verification. So I'm going to bring up a patient, and if I'm looking at happy, down the bottom here, currently you'll have online PV and DVA PV. So that's been removed, and it's now called patient verification. This is checking Medicare card details. It'll also verify DVA. It'll also verify healthcare. So if I click into this one, I'll just quickly pick a doctor. And click OK. If there is any messages that comes from Medicare, there are more descriptions here for what you need to do. This one in particular I purposely picked because this is what it looks like if there is a mismatch. It will tell you the suggested updates to the patient's record from this patient card details to the patient's new card details. If I click update details, it'll go ahead and update the details here for me. The next one I want to show you, if I am doing a Medicare check for, say, a child. Just going to bring that up shortly. And I'll go patient verification. If I click OK, this is what it's going to look like. So I've got a 2-year-old, and it's going to say patient is eligible to claim for Medicare with details provided, and also patient eligible for concessions. So the descriptions and the messages that comes up on this patient verifications in this new version makes it easier for you to read instead of just giving you error codes and then that's when you call us to check what they are. I also want to show you a DVA patient and what that looks like. So this is a patient with a DVA, and I'll click patient verification. Okay, and this is what it's coming up with. Again, if there's information that requires to be updated, it'll show you the same box like the one before that I looked at. Now, I'm also just going to do a normal Medicare verification. So on one of the patients that I've got here. So if I do an online PV, oh, that gave me an error message, but it's fine. If I do an online PV, it should say that that it's been verified. I'm gonna try another patient, sorry. Patient verification. So if you've got a Medicare card only, then this is what it's going to look like. If there was a concession card entered, it would have come up with another tick. But this is what the Medicare patient verification tick will look like when you do an online PV. So we've kind of covered what that looks like, the patient verification looks like. Now I'm going to move on to billing. In terms of how you create your bill and how you submit it, we've made some enhancements to the new invoice screen, and I'll take you through that shortly. And then I'll take you through the claim. So we're no longer calling it batching. We're moving into a claim status. We're calling it claims, which basically includes all submitted claims to Medicare, to DVA, DVA Allied, and also including any in-hospital claims, which is for the health funds. If I am to bulk bill this patient, whether you're billing from the waiting room or directly from the patient record, that remains the same. I'm going to bill this patient and set Medicare as the payer. I've got my doctor set. You've got your date. So this steps remains the same. I'm going to put in an item number and tap across. Now down the bottom, you'll find that I've got bulk bill coming up, and you can still print, email, and suppress. If I click bulk bill, it means it's going to submit the claim to Medicare straight away. You no longer need to, you can do this from version 35 onwards. If I click suppress, it means it'll just be saved in ZMID and you can transmit it later. So for clinics who would like to suppress it and review the bulk bill invoices before submitting to Medicare, maybe end of the day, you can still do that. So you don't really have to click bulk bill for it to go to Medicare. You can suppress it, and then I'll show you shortly how to submit those claims to Medicare. So if I go, if I'm to send it now, I click bulk bill, and it will come up with a message, bulk bill claim assessment, and now it's been sent to claim queued for sending. Now, we've had lots of questions around what happened if you click bulk bill and realize that it's incorrect. It's still the same process as you do now. That remains the same. You're going to have to call Medicare, get them to cancel the claim, and then fix your invoice and resubmit it. If we are billing the patient because it's private patient claims, I will then I'm going to set my payer as a patient. I've got my doctor, and actually I should bill a different patient because it's I'll just bill a different patient because it might get rejected. So I can go bill and I make the patient the payer for this one. I'll set a doctor. I'll put in my item 23 and I can go quick pay. If you're doing MA online, that process remains the same. You still record the payment and you click MA online down the bottom. If you're using Tyrell, you will see a new Tyrell Easy claim here, and that's just replacing that ET button that comes up currently. We've split them into two now, so you just simply have to click here and then follow the instructions. Same thing that you see now. It'll tell you to so you take the payment and then you submit it to our Easy Claim. For this one, I'm going to click MA Online. Now, this screen will come up. Currently, it's just an enhanced view of what you currently have, and you click Send. If there's a rejection, it'll tell you straight away. If it was successful, it'll say that the claim's been submitted. So As I mentioned before, the errors and descriptions will providing you with more information, and that should be able to help you as you come through these rejected claims. So that's billing to Medicare and private patient billing. The next one I want to show you is to do a DVA invoice. If I go to Jasper, I've done my patient verification. I'm going to go create an invoice again, put in your item number, and down the bottom you'll see DVA. And same thing as Medicare, you can click DVA to submit. So I'm just going to add item and I'll click DVA again to submit it. And then it'll say claim queued for sending. If you would like to suppress it to submit later, that's fine. You can do that as well. So that's the billing side of it. So most of it hasn't changed. It's just those new additional buttons that comes up. Those are the new ones, and then making it, I guess, easier for you in terms of your day-to-day. It'll be a huge help. The next part is moving into claims and where you actually see those claims that you're submitted, or where do you submit those claims that you've suppressed. Under management, you'll see a new button on the left-hand side now, or a new tab. It's called claims. So this is replacing batching. We're moving away from batching. At the moment, if you are to click on batching, it'll give you a different store which records bulk bill, DVA, Eclipse, or Tyro, or MA Online. We've kind of put them together into just one screen for version 35. And I'll talk through the claim status screen. That's the one that I've got open now. And I quite like how I can expand this one. I'm just going to expand it, give everyone a good look. So I'm going to cover claims in a bit more details, and then I'll move into payments. You've got under the claims tab, you've got a from and to. This is the invoice creation date, not the service date, invoice creation date. Next to that, I've got all submitted claim types. Now, these are the different claims that's submitted that you can see in this window. Bulk bill for Medicare billing, Medicare is the payer. DVA for all DVA billing. Invoices that you set DVA as the payer. Inpatient medical, that's Eclipse, more for in-hospital billing. The Medicare drop down here, if you are using Tyro, Easy Claim, or MA Online and ZMed, this is where you're going to see those claims. And I'll click on them shortly to show you. VAA, that's for DVA Allied. So the claims tab will show you all the list of invoices that sits within this date range, of course, that you've submitted. If you want to just look at the invoices that you suppressed from that day or that week, you can then click on not submitted. There's every time you make a selection here to display the results, you have to hit refresh. And then for mine, I haven't actually suppressed anything. It'll give you all the invoices here, and on the right hand side you'll see transmit claims. You'll be able to transmit those claims. It should give you this box, you tick all and transmit all the claims after you've reviewed that. I'm just going to go back to all submitted claims. If I just want to review, if you're looking to have a look at all Medicare invoices submitted, I'll change it to bulk bill, and then it'll give me just those Medicare invoices. So what's under this is that you've got the invoice number, you've got a date, which is the invoice date. The status, this is where you see whether Medicare paid it or not, and it'll give you the description if there was any descriptions provided from Medicare. Currently, this is more equivalent of what you see in your Medicare MA process report when you do your batch. So you no longer need to go in and view those reports. It'll all display in the screen under the claims tab. So you'll be able to see why an invoice wasn't paid. For this one, they've provided a reason that benefit assigned has been increased, and it's an indication that maybe I haven't updated my fees or something like that. So it will definitely help with this, just reviewing this screen. If you see there's a lot overpaid, it just means you need to update your Medicare fees most likely. If it was unpaid, it will say it'll say unpaid. I'm gonna just check this back and see if I get a bit more data. All mine are overpaid because I need to update my fees. I'm gonna go into DVA, and DVA, I can expand all just to have a look at these two invoices. We can see here, this is what's come back. It's been overpaid, and this one's still sitting. It hasn't been paid. Unpaid doesn't mean that they're not going to pay it. It just means that they haven't processed it. Same goes to Medicare. I mentioned earlier, the Medicare will show invoices that you've clicked on MA online. So these are private billing for rebates. So if a patient is the payer and you MA online or easy claim, you will see that here. It'll say assessed. So this is really helpful because you don't have to go and click on those drop downs and see whether a claim was assessed or rejected. So this is where those claims will come up. So I've kind of covered that. That's good. To the right-hand side, you can filter by branch if you've got 2 branches set up and you're billing from there. So if you've got a COVID clinic and you submit billing from that COVID branch, you can now go through and have a look at those invoices here. You can also filter by doctor. If you've got a big clinic, you want to look for one for a particular patient and look at the claim status, you should be able to click on find patient and look for them. And there are other filters as well they can use for search. I'll go into, so that kind of covers the claims tab. Now, there are 2 things I'd like to mention before I move to payments. At this point, if you are to make an adjustment, you will have to, if you are to make an adjustment to an invoice that you have not submitted, you will have to go into the patient record and adjust it from there. I'll get into adjustments on how ZMed adjusts these overpaid invoices shortly. My session yesterday, if you're wondering where you do your reporting, what we're looking at, there's no reporting. We are currently working on, that's under development at the moment for you to be able to print out a report if you're currently printing them out. Otherwise, the data will stay here. Of course, you can always come in and check why a patient was, why an invoice was rejected, overpaid, underpaid. These will remain in the system. Now, I'm going to go into payment, and that's probably going to answer some of the questions I can see on this via the chat. Under payments, these are the payments that has come through from Medicare, DVA, and also health funds. So again, you've got your date range. You can sort by, you can filter it just to view Medicare or DVA, different payers, so you can do that. And you can also filter to treating doctors. On the right-hand side, by default, it'll have new tick, and it's just to display any new payments that has come back from these payers. What we're looking at under here, we've got payment ID. The payment ID is just the reference number for that particular payment that the payer has made. What we're looking at is that you'll see one payment was just for one invoice, and then I've got a second payment, and that's for different invoices. So it's most likely what you'll see when you're moving to version 35, that one payment might come back, and then it'll be assigned to a list of invoices that you submit there. Very similar to when you receipt off a batch at the moment. So that the payment ID is there as reference. And in terms of payment date, it's already recorded in the system as well. So you don't have to go and manually and view a report to view the payment date. The status is new because you can also filter anything that was receipted in the past. It'll say who the payer is. So in this case, for this one here, that has come from DVA. It'll tell you the amount that's paid and whether there was still any outstanding under that payment. And to the right-hand side, there are just additional informations that you can see. It'll show the account details of where the money, where Medicare deposit the money to. So that's there. And the next one I want to move to is how do I receipt these invoices under these different payments? I can choose to receipt them by a payer if you want. If I go to DVA, I'll refresh, or I can go to Medicare and then you can refresh that. It'll show you all the Medicare ones. Now, from time to time, of course, you have to do manual adjustments currently, a lot of increase, decrease, void, redo, and submit. And the good thing with this is you now have the ability to, if I am to select all, because I want the system to make adjustments and receipt these invoices. Up the top here, you'll see Reconcile Payments. And if I click on this, I'm just going to move this down. There are 4 options. Allow payment. The system will go in and increase the differences. So if Medicare overpaid by $1.20, ZMed will do the adjustment for you. Adjust underpayment. It means if Medicare paid less than what you've claimed, ZMed will discount the invoice for you. If you choose, so by default, these 2 are ticked. If you don't want ZMed to make any adjustments for underpayment, you can tick underpayment and click OK because you're happy to go in and manually adjust them. Otherwise, you can untick it and just leave the first 2 ticked. The other options that's there, if there's any rejections, you can actually choose, just get ZMed to void it for you, and you can go through and recreate those invoices and submit it if need be, depending on the reason why it was rejected. So if I click OK here, ZMed will go do the adjustments for you, so you don't have to manually go into each invoice and make the adjustments. Now this goes for, it's not just Medicare, it goes for Tyro, if it's an easy claim. It goes for DVA as well, DVA Allied. So all those payers, that when you go to receipt, under this payment screen, the adjustments you can choose or let the system do the adjustments for you. And once I do my adjustments, that's all done, you can then have a look at what's been receipted. In terms of your banking, the same details that's going to come up currently, that remains the same. That's still going to show up in your banking. That'll give you, put there the payment date, where the payment came from, and it'll assign to the bank list of whichever bank list that the doctor is linked to. Now, if you've got an invoice here, if invoices were rejected and you want to fix it, again, you're going to have to let ZMed void it for you. You still need to go and and create the invoice again and submit it again to Medicare or DVA, depending where you're sending it to. So that covers claims and payments. And I do want to mention that if you have not renewed your PKI certificate in ZMID, you will need to get to that as soon as possible. You need to get it done before the 13th of March. So we've got a report and communications to go out early next week, just to remind those practices they haven't updated their Medicare certificate. You'll need to get that done as soon as possible, whether through your IT or you can book it with ZMID. Now, just going through some of the questions that has come through. So I've covered the adjustment, so you can choose to manually adjust it or let the system adjust it for you. Now, the other one I also want to mention is manual receipt and manually associate receipt. These are if a check has been sent. So sometimes you would accidentally MA online an invoice instead of bulk bill, and the check ends up with the patient. If that's the case, you can come here and manually receipt that invoice. So that's how you manually receipt it. And to associate you, or if you've created a receipt and you want to link it to an invoice here, you can manually associate that receipt with an invoice here. So you still have those two options up the top available to you for payments that doesn't come back into ZMID, but it comes to you on a different channel, whether that's by check or the remittance advice sent by post. Now, in preparation for version 35, we've covered this in our past webinars, but just to for everyone's understanding, just to be very clear, before what we're recommending is before you look to upgrade or book in your upgrade to ZMID version 35, which you will receive communications on when we're going to release the version 35 very, very soon. Before you book in your upgrade, you need to make sure there are no outstanding claims sitting under your batching screen. So that includes any, then that's our recommendations, and I'll get to the reason shortly. So that includes any outstanding batches that you need to fix and submit to Medicare. We recommend making sure that all the batches are being receipted, the DVA and Medicare batches, and also your Tyro batches before you book your before you do your upgrade. The reason being, if you upgrade and you've had outstanding batches still sitting in your ZMID, you will have to contact Medicare for them to get the payments. Medicare may still go ahead and pay it directly to the physical bank, but in terms of you viewing the report in ZMID, you won't be able to view those reports after the upgrade. So really important, make sure all your outstanding batches are receipted. And if you've got some, say you've got to a Friday and you're upgrading on a Saturday and you still have outstanding batches waiting there, you'll have to contact Medicare to get the report. So that's one of our recommendations. And don't forget, you do have up until May to do it. We've received an extension, which we're quite lucky in that sense. So you have up until May to upgrade to ZMID. So that's really important. I think that basically covers what I wanted to cover today, and I hope that helps. We will put up the link online, and we'll send you a message on where you can access that link. Thank you.